America makes up about 4% of the world population, yet we use 80% of the world opioids. Why? Because we're just focusing on the body stuff without addressing what's going on in the brain. Trauma is not going away. When you went through trauma and you go through all of those things, that emotional thing that we're talking about, crystallize it. It's there.
I've been in chiropractor literally for 10 years. After divorce, my back pain is gone. What happened is the emotional body pain travels.
Yes.
And it looks for the weak parts.
Exactly. You just nailed it. Yep.
Oh, really? So
Yes,
thank you.
Physical trauma, psychological trauma, how the brain processes pain is, it makes it hyperactive. If there is a small signal like this much, that is the signal that's coming to your brain. If you've had trauma, your brain sees it like this. What is it that my body is trying to tell me? Sometimes you don't need the doctor to tell you that. And that's why we have so many people getting surgeries and doing all of those things, and they are still in pain. Why? Because that's not the solution.
Taking jobs away, man. What are you doing?
Well,
Whatever pain you're dealing with, shingles,
Yep.
whatever. What is the questions we should ask ourselves on daily basis? During prayer, during meditation.
okay. The question should be,
Welcome to Mastering the Inner World and Outer World podcast. Today I have Dr. Asare Christian. And today, what I love about today's podcast, I talk about experience, and he's gonna give us the MD, not vocabulary, but different perspective.
yes.
And it's funny, the second we walked in and we start talking like that's what we're gonna talk about. And I said that I feel my emotional body pain, like all the stuff when I was going through, I felt it over here. And you immediately goes like, yeah, but your brain processes it. It goes to your brain.
Yeah.
So walk me through like how, because I talk a lot about depression,
Yep.
anxiety, and all the trauma wounds and all the stuff's going on. I mean, I talk about pain,
Yep.
but I talk about emotional body pain. And how does like in medical industry, because just so you know, I'm against any pills.
Yes. All right. I'm with you.
Okay, good. So we
Yes.
got a doctor there is with me. So how does our brain process and tell us like what is the medicine talking about depression and anxiety and the brain pain?
Absolutely. And thank you so much, first of all, for having me here.
Thank you.
And I thank you for the work you do in mental health. It's one of those things that we all struggle with, and we don't talk about it as much. And it creates a lot of stress. It creates a lot of harm. So thank you for the work you do. So from a medical standpoint or from a biological physiology standpoint, pain is so connected to the mind. Okay. So we talk about mind-body medicine. Everything that we do now is we consider this mind-body medicine, but nowhere is it so important than pain. And because how we do pain management in America is really just focusing on the body, that is why we have so many people in America in pain. America makes up about 4% of the world population, yet we use 80% of the world opioids. Why? Because we're just focusing on the body stuff without addressing what's going on in the brain. So the question you ask, when we have pain, in a simplistic form, pain, for example, you cut yourself. It's inflammation, and there's a signal that goes all the way to the brain. And when it's going to the brain, there is two pathways. There is one that tells you the sensation. It hurts, it feels this way, it's achy, it's numb, it's tingly. That's one pathway. And then there's also an emotional pathway. So pain always has a sensation and emotional pathway, okay? And the reason why we have emotion attached to pain signal is that pain, as we were talking about, is a protective mechanism. And emotion helps to crystallize memory. So for example, if you touch something that's hot, you don't forget to ever do that again. If you step on something that's hot, and the whole reason for that emotion to be tied to the sensation is that so we can remember. But when it comes to just having regular pain, that process takes place. So when we solve the sensation aspect of it and we don't address the emotional aspect of it, pain doesn't get better, because pain is connected to emotion and it's also connected to thought. So pain, cognition, and emotion are connected. When people are sad, their pain goes up. When people have pain, they can actually develop sadness. So we talked about depression and all of these things. Exactly. So it's all connected, and it's important that people understand some of this concept to not just focus on the sensation or blocking the pain signal, but also addressing the emotional aspect of the pain.
Okay. So how do we deal with that? Like you said, like you already, because like I got out of it through my own routines. Like what I did, like a baby steps, steps. Like a little workout, get out of the, first it was hard for me to get out of the bed.
course.
When I get out of the bed, I just stay out of the bed. And then just, just little steps,
Yep.
little habits. And then the little habits become big habits and bigger and bigger and bigger.
Yep.
And it took like months, even years to fully recover. I mean, I'm still have a horrible days. I still have a good days. I have amazing days. But you go to the psychologist and it's like, oh, by the way, or psychiatrist, that I tell you what I don't understand. Mm-hmm. They give you pills, but yet they don't test your brain. They I don't understand. Like, how can we do that?
So how we do medicine right now in general is not precise at all. Okay, and even when we are developing drugs, it's based on a specific set of population who have specific criteria. So it doesn't even fit. So that's why a lot of medicines don't work for a lot of people. Okay, and then when we are also developing these medicines, they're not really addressing the root cause problems, right?
Exactly.
Because sometimes you have to do the work. Sometimes it's not a medication that's going to solve it for you.
Because if you take the pills, I mean, you're sedating. Instead of alcohol or drug, now you're blocking. So what happens is your conscious, subconscious mind is disconnected. So you just continue to be disconnected versus find who truly you are.
Yep. And I think the issue is that sometimes people are not ready to do the work. Yes, there's a place for medicines to help people. People go through significant traumatic events. But I think we have to come to a place in medicine where we are not just focusing on, let's block the pain signal, because trauma is not going away. When you went through trauma and you go through all of those things, all of those, that emotional thing that we're talking about, crystallize it. It's there. Okay. And until you do the work to kind of work through that, that is always going to be part of your awareness, and the medicine is not going to take it away. And the medicines are basically just slowing down how signals are being processed in the brain. So we have to do a better job of, first of all, understanding why is this depression happening? Why is this anxiety happening? And it's multiple reasons why. There could be trauma. There could be biological things, chemistry that is not working well. People have different, hormonal changes. There's all of these factors that plays a part in how the brain is taking care of itself. Plus the external traumas that we can control. Plus the traumas that we've had throughout our whole life, because nothing goes away. It's always there. So I think we have to get to a place where that precision is now clear. We can check your chemistry. We can also check your life and lived experience, which is actually more important, because it's the brain that actually create the corresponding chemistry. When you've had some trauma, and that is determining how you see the world and how you think about yourself. When you do that, then the chemistry is created in the body, and the body is going to manifest that way. So it's really important to get to a place where, in your case, you did the work. You just kind of struggled through it. You were determined to push it. But for most people, they need to be aware that you have to do the work. There's place for medicines, but that's not going to solve the underlying root of why you're dealing with what you're dealing with.
Because the numbers of suicides and the number of depression is going higher and higher and higher everywhere. Yep. Like every year. It's like, the truly, even the work that I do is completely bring awareness.
Yep.
Because, I thought that I'm alone.
So many people.
Yeah.
So many people struggling with this. We keep prescribing more antidepressants, and more people are depressed. There's more suicide. So it's not the solution. It means we have to kind of look at a different lens and what else is going on in the environment. What else are new approaches that we have to bring in to really help people to fully heal.
So what is the new approaches in the medical industry? Like what is this even the subject that people talk about, or?
So I think mental health has been a huge part of medicine, that even though it's a big thing, because our understanding of the brain, even though it's evolved, it's still quite limited. So that's not something that we have like very clear, objective things. You can see things on imaging. You can make some correlations, but there is still, we're a human being and we're a spirit. We have all this other aspect of us that, there's limitation to what the science can do. Of course, I am all about having third person objective science and factors, and that makes sense. But there is still this side of us that you have to do the work yourself. And I think, that's not something that we bring into this discussion from a medicine standpoint. How we train is like, okay, yeah, we can see what's on your MRI and we can see what's on your brain and we can see what's on your labs, and that's it. But there's a whole lot more. So, and I will envision that, with time and understanding, and as we evolve, we're going to get to a place where doctors are going to go beyond like just this chemistry and what else is really deep inside that will really bring people up. And for me as a pain doctor, things that I know, yes, I can see what's going on in your levels, but even the healing takes place when people trust, right? When there's trust, they themselves start healing themselves. Mm-hmm. So there has to be that component of individual empowerment and getting people to understand that they have some power in really helping to kind of change their situation. So we have to go a little bit deeper as a medical community to really help solve mental health, because all the tools we have right now does help, but there's still a lot of people who are suffering.
Like you as a pain doctor, so when people come to you, like, do you, how does it work? It's like, I go through pain and it is like, help me. And you're like, okay.
What do we do?
What do we do here?
So what I do, a lot of people have chronic pain. So pain, there's acute pain and there's chronic pain. Okay, this is just physical pain. Okay, there's different levels of pain, emotional pain, traumatic pain and all of those things. But just talking about physical pain, there's acute pain, which is pain that happens for less than 3 months. So you twisted your ankle, that's physiologic. You're gonna have pain for your body to slow things down to allow you to heal, okay? And that's there to protect you. So actually pain is a protective mechanism. Pain tells us that something is wrong. And even beyond the physical, how we grow, and you've talked about this, how we grow and evolve is through pain. There's two ways of growing, through wisdom or through pain. Certain things happen in your life and it's painful, but it helps you to grow. And then we have chronic pain. Chronic pain is where pain has gone on for about more than 3 months. You've had herniation in your back, you've had surgery, you have physical therapy, everything is fixed, you're still in pain, okay? So what I do is when people have chronic pain, which is the one that's hard to do, everything is fine and they're still in pain. Oh, they've seen the doctor, they've done MRI, they've done this, there's still pain. I start with pain education. It's very important for people who are experiencing pain to understand what pain is, because most people don't even know what pain is. When I ask people who have had pain for 10 years, 20 years, they come to me and I say, why do you have pain? They would tell me, oh, it's my L4 herniation. Oh, it's this thing that happened. But that's a long time ago, right? So whatever happened at that time, your body tried to process it, but what's keeping you in pain right now is a function of the brain, okay? So we got to get people to understand that when we're trying to understand or treat pain, we have to work on what's happening in the body and what's also happening in the brain. So I start with just basic concept, because sometimes when you're telling people, hey, part of your pain is also coming from the brain, people tend to think that you're telling me, oh, all this pain is my head, I'm making it up. That's not what we're saying. In fact, that's true from a physiological standpoint. Pain is always an output from the brain, as we talked about. You can cut off your legs and you can still feel pain. That's in the leg, that's not there. So where is it coming from? Not in the leg, but the brain. So pain education is important. Getting them to connect the dots, that what keeps me in pain. People will say, I don't know why I woke up this morning with all this pain. Stress will keep you in pain. Stress creates cortisol. Cortisol is inflammatory. If you're not sleeping, you're not healing, you're not calming things down. That's going to drive pain. It's going to drive mental, it's going to drive everything, okay? What you're eating. People have no idea. They go, I don't know why my migraine is acting up. What did you eat? What are you drinking? What kind of people are around you? What kind of stresses? All of those things influence pain. So pain is not as simple as, oh, I've cut myself or I have a herniation. There's so many things that influence it. And then when it comes to trauma, if people have had significant physical trauma or psychological trauma, how the brain processes pain is, it makes it hyperactive, okay? So if there is a small signal like this much, that is the signal that's coming to your brain. If you've had trauma, your brain sees it like this. Everything is so protective and so painful. So it gets very, very important for people to understand what's going on in the brain, how the brain processes it, and then how do we manage what's happening in the periphery. And then it becomes of the lifestyle. Let's dial in nutrition. Let's fix the gut. Let's fix hormones. Let's fix all of these other factors. So I tell people, if you're not sleeping, pain is not going to get better. Let's start from there. And giving people those type of education. And then we go beyond it to kind of bring in other things that we need to do to help them get better.
You don't think our body is the smartest, the biggest computer, and our body can fix itself?
The body have capacity to heal itself.
Exactly.
It has all the intelligence. And I talk about the intelligence of the cell. Our cells have all the intelligence to heal itself, provided it gets the right signal. And that's the problem. So a lot of times people are stuck in a place where their body is not getting the right signal. What is the right signal? Nutrition, sleep, forgiveness, managing all of those things. When people are hanging on to things, pain doesn't get better, okay?
Forgiveness,
so all
stress.
of those signals, all those things are signal to the cell. So the cell has the intelligence to say, let's heal, or let's just stay here, okay? And if the cell is going to heal, then all of those signals has to be aligned in a healthy way.
So what you're saying, like you said, forgiveness and stress.
Yes.
So when you are toxic, when you constantly have negative thoughts and you still stay negative, and you a victim of the circumstances and you're victim of the environment that you own created, it creates the pain. And
Absolutely.
it goes to the knee, it might goes to the back, it might go to the shoulder,
The
it might
neck,
go to
everywhere.
the neck, it goes to the where. So how do you just change your state? Or
So yeah, so it
if
starts
I'm
with,
if I'm negative, if I have negative mindset, I've been like that. I'm not, by the way.
Yeah.
You know, because it's like I find I'm delusional optimistic, just so you know.
Okay, that's a good thing.
But let's say if I've been like that, if that's what I've been programmed for 20 years, how do I get rid of it? Like how, and you know, like because you know how there's so many, like I have so many friends, family members.
Yep.
It's like, yeah, I'm sick, and they've been sick 30, 40 years.
years.
They dying 40 years.
yeah.
And you think I'm joking? They're dying 40 years. And like, how do you reprogram that?
So it starts with awareness. And it is so important. You talk about like people that have negative thoughts. In fact, it's catastrophization. We call it in medicine, in pain, where when people wake up, and actually I tell my patients this, they wake up and they go, the pain is killing me. Oh my God, this is horrible. This is miserable. When you do that, you actually increase the painfulness of the pain, okay? So pain is a sensation. In fact, in the simplistic terms, pain is a sensation plus fear. And when you take away the fear, it's just a sensation. And the fear is all that emotion and all those negative thoughts that we bring in. So when people have positive aspect of themselves, pain actually gets better. So what I tell my patients is, instead of getting up in the morning and going, oh my gosh, this pain is killing me, this pain is horrible, I go, you know, it's the left hip. Focus on how good the right hip does. It changes your perception. All of that change the unpleasantness of the pain, okay? So pain has an emotional, sensory component, and it's also an unpleasant experience. So that unpleasant experience is something that actually people control, and it's a function of their thoughts, your cognition. If you have bad thoughts, you don't do well. If you have negative thoughts, you don't do well. If you have positive thoughts, so people can have pain, and they're hanging out with their friends, they're having a good time, they don't even think about the pain is not there. When they get home and something is bad or they have some stressful event and they start thinking about the pain, then the pain becomes magnified. So it's really just starting with awareness and then getting people to understand that the brain learns pain, neuroplasticity, and the brain can unlearn pain. The body learns pain, the body can unlearn pain. The cells learn pain, they can also unlearn. So that opportunity exists, and we just have to get people to be aware of it and to kind of do the work to get there.
Okay, so awareness is first. Like, you know,
Yes.
I'm alcoholic. Hey, I have a problem. I got to stop.
Yep.
So the first thing with pain is awareness.
Understanding what it is, yes.
Okay, and we both agree it's emotional pain create all the other pain. So,
Yep.
so now you talk about emotional pain. You talk about forgiveness, stress, and then you said just right like 2 minutes ago. You said fear.
Yep.
People are scared of it, like because they never try the other way, and they scared to even share something. What if I change my mindset? And
Yeah.
people, so that's when the fear, because they truly don't know how to go through it, because it's like, am I delusional? But they don't like to be in the pain.
Yeah.
But they don't know how to deal with that. So they are, how do you face the fear?
Yes, I know
I
exactly
mean,
what
I
you
know
mean.
how I do it, but I just want to hear you. How you?
Yeah.
Because you dealing with those patients, and they come to you. When people come to you, it's like, help me, dude.
Yep.
Like, you know what I mean?
Yep.
It's like how do and then, because I gotta tell you the true story, okay? My father's gonna hate me for that. So my father has shingles 12 years ago, right? And he tried every single thing. Dad, I
Yeah.
love you. Remember, I love you, Dad.
Of course.
Every single thing. And then one doctor, he came and he gave him a book. Read this book. My father.
Why you give me a book?
Why do you give me the book?
Yep.
And you know, at that time we were making fun of it, but truly that was the answer. But you don't want to hear it.
Yes.
Like, you know, even when this happened 10 years ago, I wasn't on the consciousness level. That was like, what a bullshit. What a dick. Like,
Yep.
he
Why you
gave
give
my
me a book?
father a book.
Yes. Yes.
But that was truly the answer. Because now it's been 12, 15 years, so the pain becomes his identity, and he cannot even live without the pain. So it's like every morning, he's like, hey, that's
yeah.
what it is. And I know, and it truly is, because, you know, shingles attack the
Of
nerves,
course.
and it's truly
painful.
It's a
It's
truly
horrible.
physical pain.
Yep.
But how do you do it? Like,
So you said something
you
that
give
is
people a book?
Yes. No, not that, but
Dude,
don't do that.
dad's
If
gonna
I
hate
if I
me for
do that, people if I do that, they're not gonna show up in my clinic and just tell me to whatever. But so you mentioned something that is so important for people to hear, which is people that have chronic pain, the pain become their identity. Okay? So it's actually fearful for them to imagine, who would I be without this pain? Even though they don't want the pain, It's become such a part of their lifestyle that, I can't go anywhere with you because I'm pain. I have, so not that people want that, but eventually like it's thought and habit and it becomes an identity. So that become a very scary point where people will come in, they've had all this pain for so long, and I can do some procedure or something that takes away the pain temporary. It's not like it's gone, it's still there, but even when they're feeling like, oh my gosh, there's no more pain, they just don't like that idea. It's just
they create the pain.
They create, the pain comes back. So the identity part of the pain is something that people need to work through. So it becomes, again, getting people to trust, having a provider, because it's hard. It's not easy to do. That's why people can do it. So it becomes really having a provider that people can trust and getting them to understand what is keeping you in pain. People are always aware of what started my pain is the shingle, is the accident, is the fall. But what is keeping you in pain is very different from what started you in pain, okay? And what's keeping you in pain is a function of your habit, your thought, your brain, what you put into your body, and the environment. So those are things that people have control over. But then when it becomes people's identity...
By the way, guys, I did not pay him. That's what I think.
No, I mean,
I was like, this
no,
is like...
everything you're saying is like, oh my gosh,
because I do
so
want to hear it.
important.
Because I completely agree with you.
Yep.
Because what happens is I have like bulge disc, stigmatized disc, and all this stuff. You cannot do Ironman. You cannot do anything. I've been in chiropractor literally for 10 years. After divorce, my back pain is gone.
Yeah.
What the
Yeah.
My chiropractor called me like, Jarek, are you mad at me? I'm like, no. My pain is
gone.
My pain is gone.
Yeah.
So it was truly the emotional pain
component, the
that
stress,
was related.
yes.
And then the second, like, I got divorced, gone. Like literally, I mean, not immediately, but in six to like 12 months, my pain was gone.
I hear that all the time. Yep. That you're not, I mean, this is a
But
real
I
thing.
didn't do shit.
Yep. You move yourself away from the stressor that was perpetuating your pain.
Yeah.
Okay. And sometimes people don't want to be open to that idea.
Because so it's like it's we also can heal our own body.
We can do it.
So I give you another example. It was 4 days before my Ironman, right?
Yep.
And I mean, my back is still weak. You know, like, yeah, you got to get your core strong. You got to eat. You got to, like, to me, stress and sleep and fear and it's everything for the body pain. And then what happened? I think, and I like that's what I'm that's why you hear. What happened is the emotional body pain travels.
Yes.
And it looks for the weak parts.
Exactly. You just nailed it. Yep.
Oh, really? So
Yes.
thank you. So
Yes.
what happened is it looks for the weak parts. And it's
it
like, oh my
manifests there.
God, it's my knee.
Yep.
It's not your knee. You have something going on. Like I have all the blood that's going on for years. Like, well, you got to get rid of the stress. You got to get rid of the stress. I'm like, what are you talking about? I have zero stress. I retired like 10 years ago. I have kids. I have this. Like I have zero stress. I didn't know what they're saying, but the blood results were telling me that I have a stress. You know, the hormonal, the cortisol and all this stuff, right? But I did not felt it because I was hiding.
Yep.
So what happened is the body, I'm calling emotional body pain, right?
Yep.
You can call
and
it,
I'll
you
explain
tell
it because you just nailing it exact. That's exactly true.
So what
what's
happened is, and then suddenly like, oh, it's on this side. So then I read the book. There's a book. There's like, it depends which part it hurts you. So that's the emotions like you carrying. Can you Google the book? I forgot the name because I want people to read the book.
Is it The Body Keeps Score? Or
yeah, yeah. I think that's what it is, and it tells you exactly what it is. So, and it truly was happening.
Yep.
And then what in attack, and then finally attacked my head.
Yep.
You know, when I was completely depressed, I couldn't get out of the bed. So it went from my ankles to my knees, to my back, to my shoulders, to my neck, and suddenly it was just too much because I never dealt with that.
Yep.
And like you said, I have to open my wounds,
walk through
and
it.
just sit with that, and just put a salt in it, and just deal with it.
Yep. And the body is like, this book we talk about, the body keeps score. So the very thing that you were talking about, and is super, super important for people to understand. And there's physiological meaning to it because you said it's going to manifest at the weakest point, okay? So when you have stressors going on in your body, you lost somebody, there's stress, there's all of these things that are happening, and you don't deal with it, eventually, if you've had like a back problem in the past, the pain is going to manifest there.
Yes.
And you're gonna go, oh my gosh, this my back pain got
Is
worse.
is it manifesting the pain or just the pain goes there?
The pain goes there. So I mean,
Okay.
that's how the body is just showing like, hey, something is up that you have to deal with. And pain is a signal, okay? And it's like we don't listen. The body is always keeping score. It has all this intelligence. It wants to heal, and it's just saying, hey, pay attention. And when we say pay attention, or when that signal comes in this environment, what we do is like, doctor, fix me, okay? Instead of what is really driving that? Is that relationship? Is that unforgiveness? Is that bad food? Is this bad habit that
Guys, I
you
hope
need
you
to
listen
address
to
with?
this shit.
So
This is
definitely, I think everything that it's so on point, and people don't understand like pain is there to warn you that you need to pay attention, whether it's what you put in your body, whether it's what you put in your mind, and more importantly, getting you to grow. The whole idea is for us to evolve and grow, and all of those are signals that we have to pay attention to.
Okay, so love it. So because I was neglecting my emotional body pain, right?
Yep.
And then when it get to the physical pain knocked me down. The back, the knee, suddenly my knee came back out of nowhere. You know what I mean? My knee came back, and suddenly the physical pain was a lot bigger. And when they combined, when I was like, when I remember when my kids were leaving my home, and I was screaming. There is nothing better when the emotion. I mean, the physical pain I can deal with that. With the emotional pain, when they were connected, it's like the demons were like freaking like
Yeah.
Like, what the is this? In my head, I was like sweating. I was screaming, and I was like, I didn't know even. I can't I don't wish anybody to experience this pain.
Yeah.
And both of them, they went like start walking together.
Yep.
And I couldn't like that's why I want to almost took my own life because I couldn't deal with this.
Yep.
And I become like the voices is like I believe and identify with the pain and the voices, and I almost took my own life. And like I don't want anybody to go through it. So why are there like the early symptoms and because people come to you usually they pretty much. They sick of it because nobody just go to the doctor. Oh, by the way, I feel a little bit here, dude. It doesn't go that way.
No, it goes a long time before the show.
You know what I mean? If I have access to you, I will call you. It's like, hey, Dr. Christian, and just this is happening, and you just said, Jarek, just try that.
Yeah.
People don't have the access, but so when people come to you, they pretty much already
On that end, yes, and it's the biggest point that I hope people would take away from this discussion is that pain is connected to your emotions and your thought. And in fact, in the brain, the part of the brain that processes pain is the same place that does your thoughts and that does your emotions, okay? So those are three things. And the pain, if you can control it, you can control the thoughts and you can control the emotions, okay? So those are things that you kind of have some control over, but you have to be willing to do the work. And it takes really getting to a place where you, like you said, have to dissociate yourself from that identity of the pain, okay? And you have to ask yourself some tough questions. What is it that my body is trying to tell me? Sometimes you don't need the doctor to tell you that. People will come to me, they've lost their daughter, something has happened traumatic in their lives, and they go, oh my gosh, doc, my back is killing me, the pain is shooting down. If it was another doctor, all they do is like, let's get a new MRI. They don't need a new MRI. They need to be understood that, yes, you just lost your daughter. Yes, of course, your back pain is gonna be worse. Things are gonna change. Your body is telling you there's stress and there's all of those things. So it's really important for people to pay attention to some of those signals. And it's not always, doctor, fix me. Because in fact, the doctor cannot fix you. And that's why we have so many people getting surgeries and doing all of those things and they are still in pain. Why? Because that's not the solution.
taking jobs away, man. What are you doing?
Well, people are still going to want that. We want people to wake up to, because we're not doing a good job. It's really horrible. Pain affects so many people. Pain affects more people than diabetes, heart disease, and cancer combined. It costs a lot of money also in America. And it's because we've only looked at pain through the lens of orthopedic and biomechanics. What is on your MRI? That's why you have pain. No, that's not that. Okay? The unforgiveness, the stress, the junk food, all of those things, the people you're hanging out with, all of those people can perpetuate your pain. So people need to understand what is keeping you in pain is more important. Okay? So it's not what started your pain. The herniation heals. Most of the world, around the world, people don't get MRIs. They have herniations and they heal. Here, everybody have a herniation on you. Oh, let's look at your MRI. You have a herniation. Okay, you need surgery. Let's do a spine injection. It didn't get better. Now you need surgery. But not addressing the real problem. You're in a toxic relationship. Surgery is not going to fix that, okay? Surgery does not cut out pain. Surgery just fixes structures. So you go back to the surgeon and go, well, I did everything, and why? And then people go, why am I still in pain? Okay? So why you are in pain is something that people need to be open to, because people even get offended. When I try to tell them that, hey, you got to pay attention. What else is going on in your life, right?
Yeah.
Well, you're the doctor. What do you see on my MRI? And everybody's chasing MRIs. The more MRIs we do, the more surgeries we do. And it still does not provide the outcomes that we are looking for. So I think people need to, when it comes to pain, it's a subjective experience. Pain is a subjective experience. So only the subject, only you, not me, the doctor. I have all these intentions of being able to help people to heal, but only the subject can become aware of it and to open up to what's keeping them in pain. Okay, I can point you, I can provide education, but people need to be open to that.
So you're not giving books?
Well, the books teaches you, because the book that your father got actually taught him about the neuroscience of pain.
He never read it.
He never read it. He just went away.
Okay. He got so mad. We thought we were mad about it all the time.
Yeah. But you have to do a little bit more than just give somebody a book. So I don't.
Yeah, they got to read it. They got to go through it. You keep saying do the work, but Doc, what do you mean do the work?
What is that? Okay.
What do you mean you do the work? Like, people don't understand. It's like, I love, like, hold your space. It's like, what do you mean hold the space? What do you mean do the work? Like,
yeah,
like in your, like, it's like, so, Doc, what do you mean do the work?
So do the work is, getting people to have this self-discovery. Okay, I'm talking about, what keeps you in pain? What keeps you in pain? It's getting people to wake up to go, oh my gosh, when I got really mad about this thing, the next day I woke up, my back stiffened up. When I had this argument with this person, the next day my leg was painful. When I went out and I was drinking, the next day my migraine got worse. So it's getting people to wake up to those signals, okay? So when you have that self-awareness, then you go, oh, I see. So I have to figure out how to modulate that. How am I going to have these interactions? I had this one patient who was always getting her migraine triggered, and it was due to some coworker that she interacts with. She never put it together. Anytime there was this tension between them, she wake up and it's just like recognizing and go, okay, I'm gonna go to work tomorrow and I'm gonna meet with whatever Becky, whatever name I'm making up. And when Becky says certain things, this is how I'm gonna process it. And that away took her pain. So doing the work is wake up to what is keeping you in pain. People will say, I don't know why I'm in pain. But when you open yourself to it, that any signal, any stressor, any nauseous stimuli, your physiology, your body just processes that as a bad signal that leads to creation of inflammation, that leads to creation of pain. So there is a scientific basis for it, but people need to open themselves to what that is. And sometimes it takes education, right? Sometimes people don't know that, oh my gosh, this is why I'm in pain. So getting a provider who understands that, educating them, empowering them, is what's going to get people to do the work. And there is, pain reprocessing therapy. There's a specific therapy called pain reprocessing therapy. It's kind of the same concept as CBT, cognitive behavior therapy, because then you talk about your pain differently. And I'll tell my patients, when you have the pain or when you have a flare-up, don't call it, oh my gosh, this pain is back and it's killing me. Just say, I just have a flare-up, it's going to get better. Instead of saying the pain is bad. When people we've actually studied this, when people are talking bad, negatively about the pain actually hang around a lot longer, because your brain is going, oh my gosh, we are dying. We are not safe. We are not safe. We are not safe. And it makes everything very hyper.
It's funny. It's not really about the pain. It's everything in life. It's exactly the same way.
Yep.
If you're struggling with the relationship, you're struggling with the business, you're struggling with any activities, anything you do, it's like, if you complain a bitch about it,
doesn't get better.
I mean, really, you're gonna stay in the dark place a lot longer. I mean, we talk about the pain, but we actually talk about the physical pain. It's exactly the same. You can go change the environment, but if you go to the same routines, the pain will not change.
Yep.
You as a human will not change. You will still stay the same.
Yep.
And the pain was still like, hey, by the way, I'm still here. You did not address me.
Yep. You keep showing up.
Yeah. You changed the environment, but you went exactly to the same routines.
Yep.
It's not going to change.
It's not going to change.
So let's say, let's talk about the pills, right? I mean, the antidepressants or even the pain pills.
Medications, yes.
Right, medications. So would you suggest, and I'm just asking, I'm just picking your brain. So take the pills, because let's say you're sick of the pain, right? Mm-hmm. Take the pill, but change the routine. right?
Yep.
And go, because for me the best, if like I always like, if anybody get in a ski accident like what I have, right? When I was 6 months in the hospital, 13 surgeries, and I almost lost my leg. The best of the advice that I give to anybody right now: get a psychologist,
Yep.
find a therapist. It's not what Jarek. I mean, I have to go the physical therapy.
Yep.
Yes, you do need physical therapy,
But you need
But
the-
I think I create more in my head
Yep.
than actually the accident did.
Yep.
And yes, the reason I'm telling you, I become a victim of the accident.
Yep.
And
Instead of addressing what's going on here.
Exactly.
Yeah.
So how like, dog, shut up, man. It's like, don't send me to psychologist, like,
Yeah.
dude, because people have, it's the stigma. If
Yes,
don't send
absolutely.
me to a therapist, brother. It's like, dude, there's nothing wrong with me.
Yep.
How would you address that?
So
Because I
that's
want to bring the stigma.
yes, I think that's a really important point that you bring up, because I actually have the same struggles where I'm talking to people and say, hey, you know, I think it's worth it to maybe talk to a pain psychologist, because I'm a pain doctor. I mean, part of what I do is actually psychology. People come in and they're talking about pain because pain is not a diagnosis. Pain is a symptom. Okay. So people, it's not a diagnosis. Something is manifesting as pain. What is driving that pain? And when people come to me and they're talking to me and they're telling me about their pain, there's all of these other things that are trauma experiences and other things that's going on. Their work is hectic. They're busy. They don't sleep. They don't do all of those things, right? So when I even make the suggestion that, you know, I think, you know, yes, of course, you have this back pain. We're going to do the MRI. We're going to do all of those things to make sure that physically nothing is there, nothing is wrong. It's also important to work on the stresses that's keeping you in pain. And sometimes that discussion can be a little hard, because I've had patients who never came back because I told them that it's, you know, you need to see a pain psychologist, and sometimes it's very clear that, you know, people are coming to me and they have physical pain. I'm a pain doctor. I mean, I understand some of those things, and I've also done some work myself to understand where people are. And people can come in with pain where I know, like, this is physical pain, but there's such a huge emotional component to this pain that they need to address. So it's really kind of building that trust. So what it is initially when people come in, I kind of build that relationship, okay? Because if somebody show up in my clinic and I just tell them, you know, go see, it just doesn't vibe, okay? So getting them to understand and then getting them to have this awareness. So I just send them home and I'll give them an app that gives them some pain education about breathing. It's called pain reprocessing therapy. And then I will ask them, like, when you go home, just pay attention to certain things. What happens to your pain when you get upset? What happens to your pain when you're sad? So then they start realizing, oh, it's not just the pain that the doctor need to fix, but when I got upset, I actually had a lot of pain. So then they start opening to, oh, maybe there's something else that's keeping this pain in place. So it's this self-discovery, self-awareness, self-awakening that people need to make, so then they get open to that. And that's my job as a physician, to really kind of hold people and get them there. It doesn't jive with everybody, but, you know, I try to be honest with people and say, you know what, I can help you this far, but I think we need to bring that in. And it's not just one or the other, okay? Because sometimes it's hard it's easier to hack, you know, I always say it's easier to hack your biology than to hack your psychology. This one is hard to do, okay? So if we can get everything optimized, if we can get you to sleep better, if we can get you to optimize and not eating junk and doing other things, then it's actually a little bit easier to do this work, okay? But if everything is dysregulated, you're not sleeping, you're still stressing, the same environment, the same toxins are playing a part, then it makes it so hard to even get the brain, because you are in this body and the body is part of the brain. So we have to make the body actually as healthy as possible so that the brain can do the work it needs to do. And it just takes time to really connect with people and get them to feel safe to be able to do that work.
But so we talk about the brain, right? So I talk brain is a conscious mind.
Yes.
And then we have a subconscious mind, is the whole body.
Yes.
So what happens is the subconscious mind is the whole body that is calling you, like, there's still something there, there's still something there, there's still something there. So what you're saying, take care of all of this stuff, so it can just go to your brain a lot healthier, so you can connect it with your subconscious and subconscious mind. It's like, hey, what's going on? And bring the awareness. How, like, I because you also dealing with, because when you say somebody like, hey, it's something bigger, people don't want to, he doesn't want to give me more pills, or and because you have to be concerned about addictions, right?
Yes, absolutely.
I mean, you have to be concerned.
Yeah.
And this is why he doesn't want it, so they go and find a new doctor, even though you give him true
Yep.
true exit out of
To heal.
the
Yes,
the
absolutely.
rabbit hole. You
Yep.
know what I mean?
Yep.
Because even when I was like drinking, it was like there was a rabbit hole.
Yep.
You know what I mean? It's like shit. This when I drink, I'm gonna feel better. I'm kind of connected, even though I was completely disconnected.
Connected, yep.
You know, I'm sedating. You know, and then I start sedating with the painkillers. It doesn't work
That's not what.
because I'm like a walking, like a walking zombie.
Yeah.
I don't sleep
Yeah.
because when I take a painkillers, like not knock me down. When I take a drink, I just never go to the deep sleep.
Deep sleep,
I
exactly.
never go to the
Yep.
REM.
The rest-
So what happens is, it helps me up to fall asleep. It felt me up to fall asleep, but I slept like like when
Do your
at
oral
that
ring?
time I didn't have an oral ring,
Yeah.
but my oral ring would probably give me like, dude, you don't sleep.
Yep.
And because of the sleep, the stress, and everything else, my body just break.
Eventually breaks. Yep.
Okay, tell me, how do we tell somebody who is going through, let's say, had an accident or got a back pain? Because
Yep.
I don't know what pain you're dealing with the most. And it's like, dude, bullshit. Like I've been in it, 5 years. If you've been in a pain 5-6 years, or like me, 20 years, it's at what point? Because for me, I hit it, brother, I hit the threshold.
Yeah.
Dude, like what
Went to the bottom. Yep.
I can't do this shit anymore.
Yep.
What do you tell people that? I mean, we talk about awareness, bringing the awareness,
Yeah.
breaking the
Yep.
the consciousness. What tools would you give him? Like, or maybe different. What question would you ask them so they wake up on their own?
Yes. So one is getting people. So even before I get to that question, I want people to understand that pain can be healed. Okay. The body learns pain, your brain learns pain, and the body can unlearn pain, and the brain can unlearn pain. It has that capacity. Intuitively, it just wants to be there. Okay. So that's the first place that people have to. So first of all, that belief needs to exist. People will say, I'm in pain forever. I'm just going to deal with it. And I'm just going to be in pain forever. If you say that you're going to be in pain forever, you're going to be in pain forever. Okay.
My father already said he's gonna die. In
Yeah.
pain.
So if that's what you claim for yourself, then yeah, you're right. You're going to be in pain because when you say that, you create that corresponding chemistry. We've done studies where we put people in MRI machines where they have back pain and we just tell them to close their eyes and imagine yourself bending down to pick a piece of paper. They're laying flat. Just thinking that creates pain in their back that we can see on the brain. It creates the corresponding chemistry. So the brain is so powerful in modulating our thought and in modulating our physiology and in modulating pain, okay? And then the second thing, so first of all, you have to believe that you can heal your pain, okay? That pain can get better. The second is becoming aware of what keeps you in pain. And even if you don't want to deal with the psychology, even if you're not there yet, is the simple things. If you're not sleeping, pain is not going to get better. If you're eating junk, pain is not going to get better. If you're not moving, pain is not going to get better, okay?
So how can I move? I cannot move. I'm laying in bed. My back hurts. I cannot move. I cannot walk.
So we start from one place.
I'm just saying.
Yes. So this is why
I've been there, brother.
Yes. So this is where you
Shut up, doc. I cannot move like dude. You have to move. I can.
So you have to see Dr. Christian, okay?
Okay.
So you need. So that's why we need help, okay? So a lot of times, kind of like people are going to places and their system is failing them. You go to a doctor and they go, "Well, you're fine. Nothing is there." But it's people who understand that there is so much deeper to pain than just what we see on your MRI and what we see on your lab results. So finding a partner, a physician who understands that there is a lot more. So it's baby steps. I give people strategies. I mean, I'm a physical medicine and rehab doctor. I deal with spinal cord injury and brain injury and all of these people who have significant disability. So I understand like the incremental things, okay? It's even just the fact that you're gonna wake up this morning. So for example, even if you can't move, we're just gonna give you the instruction of get up in the morning, put your feet down and just like, oh my gosh, I'm grateful that I can move my leg, okay? That's just a simple thing you can do. So it's just gradually getting people to get there. It takes time, right? So if you're at that level where things even moving is unbelievable and it can be done, then we need to kind of put things in slowly to try to get you there, okay? So those fundamental things that I talk about, movement and all of those things, it's just a little baby step. What can you tweak? If there's just one thing that you can do that. And it starts with like the thoughts, okay? So even if you can just say, okay, my knee hurts, but this knee feels good, that's a place to start. And then building on that, okay?
Why are we so stubborn? Why we don't want to listen when we're in pain?
Well, I mean, so that's a great question. And I don't have the answer to that. But I think it's awareness, right? So we just operate with this subconscious mind, and we things are just operating. People are not aware of it. Okay, people are just going through emotions and every day and everything they're doing. So it's hard to get to a place where you ask yourself questions and be honest with yourself. And I can even talk about my own experience as a pain doctor. Recently, not too long ago, my knee just blew up out of nowhere. Okay. So my knee just blew. I've never had this issue where my knee was swollen. I couldn't sleep and all of that. And a traditional doctor would be like, "Oh, it's biomechanics. You probably torn something in there." And I knew what happened. It was like just a lot of stress. I was running business. I was changing my business model. I'm studying for board exams. I had some issue with family. There's all of these things that were going on, and eventually, it manifested here. I've had trauma with this knee. I've fallen down a couple of times with it, and some other issues, and this blew up. Okay, so I knew that I didn't have to go.
Travel. It finds the weakest spot.
It finds the weakest spot. So I knew that
I did not make the up.
No, you didn't make it up. No, that's why it showed up. It blew up in my own physiology. So I understood pain, and I understood what was going on. That it wasn't like I need to go do an MRI. I need to go do all of these things. The thing was for me to just pause and say, "Hey, man, you got to slow down." Okay. So it's really getting people to understand that you have to pay a little bit of attention, and having a provider or a physician who understand this concept. So it's not just blocking the pain signal. Let's put it all together. Let's make you healthy. And for me, what I do is, in fact, I started my practice because I was just doing pain management. I was doing injections. I was doing procedures. People keep coming back. And what I recognized was that when people are healthy, pain gets better. So it became, let's figure out a way to make you healthy as a way to solve pain. And that is the little things that people can control. Eat a little bit better. Sleep a little bit better. All of those little things makes a huge difference. Okay. But the question you asked me is like, why we don't change that. That's a deeper one for me to understand. I don't know why, I think it's just, I don't know. Maybe you may have a better answer to that.
No. I mean, we know what we know, and we know how to really manifest it, and we know how to just send a signal, and there's like something going on. Like I know, and I'm trying to figure out if it's relationship, if it's business, if it's money, if it's something. And I always like deal with this stuff. But I don't panic. I really don't panic. I really don't panic.
Yeah.
But it took me a lot of work and awareness.
Yep.
And a lot of my body got beat up. A lot of doing Ironman. Like for me, physical pain is like it was escape of emotional pain until it just
a lot of people do that too. Where they
mean?
wouldn't deal with the emotional pain and just keep pushing the physical.
The physical pain.
But let me ask you, how do you get out of it? What was what were the levers that you were able to push for you to be able to kind of move through that experience?
I start dealing with what happened is the second I start connecting this stuff
to your emotions.
Because when I start connecting with emotional pain, suddenly my whole body start healing.
Yep.
It's truly like suddenly I mean, I do a lot of biohacking. I do a lot of stem cells. A lot of BPC 157, whatever the joint was. A lot of peptides, the Samolin. I do all this stuff. NED plus for my brain. SSS1 for my brain. Like I'm biohacking. I'm good. Like amazing, right? Yep. So I do everything. Meditating, praying. Like sleep is for me, dude. I have a routine to go to bed. Like don't touch this phone. Read. Like I have my own routine. Like sleep is for me everything. And then everything got connected, and I'm still working on it. But it still attacks me sometimes.
Yep.
And after any a breakdown, emotional breakdown, like I see I'm struggling, immediately,
it's pain.
Or my knee, and you're right. Like this, it goes to always the weakest part.
Yeah.
And I think it's just the pain travel, and we got to figure out how to control it.
Yep.
And I'm staying. It is within.
Yep.
It's truly like we have everything within what we need to cure it, and you can even when I do, when I have cravings or I have like there's something going on, I cannot figure it out.
Yep.
I go on the water diet for 7-8 days. You know what I mean? Like get all my toxins out. Because it's maybe too much peptides, maybe too much mushrooms, maybe too much coffee,
too much signals,
maybe too much and I cannot figure it out. So I do the full reset.
Yep.
I pray, I meditate, and do water diet. That's it. And then figure out and usually what it does, it calms the out of me.
Yep.
And guess what happens? Physical
feel better.
pain is gone.
Yeah.
And physical pain is gone.
Yep.
So I still I'm going, what question should we ask ourselves? I'm going to go back to the question.
So the question, and I know we've kind of talked about it a little bit, but what people need to ask is
themselves. Like when you alone with your thoughts, it's like, hey, I have all this pain. I'm got to see my doctor, whatever, head, leg, back, whatever pain you're dealing with, shingles, whatever. What is the questions we should ask ourselves on daily basis, during prayer, during meditation?
Okay. The question should be, what is this pain trying to tell me? And what is this pain trying to teach me? Okay?
Fuck.
Okay.
Putting on my list.
There is a saying, it says life is a lesson and pain is the master or something. So there's some saying like that, okay? So when you have physical pain, any pain that you have, even if it's physical pain, is dysregulation at the cellular level. If it's an emotional pain, it's something else that you need to pay attention to. So the question is, what is the pain trying to tell me? And why is the pain there? Okay? It could be that, something that is physical that we need to pay attention to. In fact, the reason why people, number two reason why people go to the doctor is pain, okay? Maybe it's cancer, it's normally not that, but like pain is a signal that you're just like, oh my gosh, what is happening? What's going on? You don't know, right? And the brain stops making meaning. So when you ask the question, why is the pain there? And then you have to be open to that answer, okay? Because the answer people are looking for is, oh, it's a herniation. People are looking for the biological explanation because that's easy for a doctor to fix, okay? Oh yeah, if I have a herniation, then I can get an injection and fix it. But what else is driving that pain state? So I think people need to ask that question, why is the pain there and what is the pain trying to tell me?
So and you know what, you saying that, and I'm going through my head, it's like you have a knee pain and suddenly your tooth start hurting. and because that pain is bigger,
you forget about this pain.
We forget about
this
that.
Pain. Yes,
and,
exactly.
And I was going back to when I was doing the Ironman 3 days before, I bent over to pick up the key and my back, I was like, shit. So I went to my friend, it's also Sam. It's like, Sam, that's what I'm like, I have Ironman, like, you got to help me. Well, go see him. And then what happened is we put, like, he was keep putting into my knee, like, like the electrodes and like shocking my knee. I'm like, dude, it's my back. And he's like, dude, we got to body, your brain, we got to send a signal to focus on this so this can heal. 4 days later, I did Ironman.
Yeah. So the body is trying to protect you. Okay. So same thing, right? If people will have this pain that get masked because another pain is taking their attention. Okay. So in fact, physical therapy will do things that will kind of create pain somewhere else so you can kind of distract and get you to move through it. So it's important to understand pain. If you're dealing with pain, you have to do the work to understand what is the physiology of pain, what is the psychology of pain, even more importantly, okay? And there's resources there to get people to understand all of those things. And then you have to do the work. The work is hard. Find a physician who understands that. There's so many doctors out there. And it's like, it doesn't have to just be a pill. Yes, there's a place for those things to take away the pain, but let's fix what's the underlying source of that signal. Do we need to fix your microbiome? Do you need to balance your hormones? Do we need to put some cellular dysregulation that we have to fix from? So there's all this cellular, from my standpoint, I understand the brain side of things. I understand the cellular lens. I understand the biomechanical lens. I understand function. And all of those lenses have to be put together when we're trying to solve pain because it's not just one thing, okay? So you can have an emotional pain that has manifested as a physical pain. Because of that physical pain, now you have weakness in your leg. So even when you fix that emotional pain, you still have to do the biomechanics correction to get everything else to merge, okay? So that's an important concept for people to understand that we have to work on this and we have to work on the body. It's always together.
Last question, brother.
Yes.
Inflammation.
Okay.
Inflammation. Isn't like, I'm getting goosebumps. Isn't, because for me, inflammation, like look at what happened to your knee.
Yep.
That's inflammation.
Yeah.
How do we control the inflammation? Like, do not panic when something is inflamed. How do we control it? What do we take? I was taking a lot of ibuprofen.
Yeah.
And that shit didn't work.
No.
Right now, I was putting a lot of icing on all my, because I do Ironmans. So it happened even this. So the ice is just kind of like helping with the pain, but the body doesn't have I don't want to put an answer on you. The body doesn't let it recover. So walk to when you have an inflammation, how do you deal with that? Do you panic? Don't panic? Like what's going on?
Yeah. So one, let's even explain what inflammation is. Okay. So inflammation is your body's response, like release of cytokines. It's a communication process that is there to communicate some type of information, and some of that information is picked up by your nerves and it creates pain. Okay. So inflammation by itself is not pain. Inflammation is just inflammation. It's just communication cells and all of those things. Okay. And inflammation that gets to the brain and the brain interprets that becomes pain. Okay. But when we hurt yourself, when you like strain your muscle or something happens to you, there is this communication of the cells. You have astrocytes and you have all the cells that are coming together to try to heal the place. Okay. And they create that pain signal for you to slow down, because now we don't want you to keep injuring the shoulder. Okay. You've already strained something in here. The body is saying, okay, I want to create a pain signal here so you can pause and get these things to heal. So in that healing cascade, the body has the potential to do that. But the thing is that pain it's not just this. It kind of affects everything else. The pain, then you can't sleep, you can't do all of those things. So what we want to do is we want to try to figure out a way to block the pain and also get the body to heal. Okay. So as a pain doctor, what I do is I try to block the pain and I also try to get the body to heal. In a lot of the conventional medicine approaches, or before I even started my own practice, what I did was just blocking the pain and doing nothing to get the body to heal. Okay. When I give you ibuprofen, it's just blocking the pain signal. And in fact, it blocks some of the healing cascade. Okay. So when you have inflammation, there's two pathways. There's something called the Cox pathway and Lux. I don't want to confuse people, but basically, there's two pathways. One of them is going to lead to pain. One of them is going to lead to healing. When I give you ibuprofen, it blocks both. Okay. So what we want to do is I want to just block the pain and leave this healing cascade to take place. And this is where we can use some supplementations, omega-3s, turmeric, all of those things that can be helpful. Sleep, super, super important. So when people are dealing with pain, this is when they have to double down on their healthy habits. This is not when you need to drink. This is not when you need to stress. This is when you need to rest, recover, and give your body the chance to heal. So there's so many things that we can do from a supplement standpoint, from using modalities, shockwave therapy, other things that helps with regeneration, making sure that you can use peptides. So there's all of these other options that allows the body to heal, but it's also important to get rid of pain right away, because when pain hangs around for too long, then it becomes chronic pain. Okay. What it is that you have this signal that's going to the brain, eventually the brain goes, okay, you have to breathe, you have to think, you have to eat, you have to communicate. So the brain creates a pathway. That actually happens. That's how you develop chronic pain, where your brain is now the one that's creating the pain. It's not even coming from here anymore. The brain is going, okay, I got to make sure that you remember not to move your knee. So I'm going to make this astrocyte and microglia in your brain to keep, it's called neuroinflammation. Okay. So this neuroinflammation gets turns on. And it's not just now the inflammation. Now you have neuroinflammation, inflammation within the spinal cord and the brain that's perpetuating the pain. So it's really important to get rid of the pain right away, strengthen muscles, biomechanics, physical therapy, any of those things, and then use modalities that helps you to heal, which is where the cellular medicine, peptides, and other things, nutrition, all of those things can help. So those have to be put in place to help.
Guys, you got all the answers. It's not only from me. We got it from the doc.
Yes.
All the pain, you can cure it. You got all the answers within. You get all the power within to cure all the pains, emotional, physical, and they're all connected.
Yes.
So tell where people can find you. And
yeah, so my practice is in Wayne, which is a suburb of Philadelphia. And the name of my practice is Aether Medicine. It's AETHER Medicine. And people can find us online at www.aethermedicine.com, or they can also call us 484-803-1101. And what is different from what I do is we take a global look at your pain, okay? From the psychology, from the physiology, from everything else, and from the environment. Because pain is influenced by various degree of your biology, your psychology, and your sociology. Okay, so if I fix your biology and I don't fix your psychology, or I don't fix your sociology, pain doesn't get better. We got to put it all together, and there's healthy ways to do all of those things. So people need to know that there's answers, and we're here to connect and help people heal.
Love it. You know what to do. Subscribe, like, share it. Definitely amazing content. Love you guys. Bye.
Thank you so much.
Thank you, brother.
Thank you for listening. Leave your comments and subscribe for more insights on mastering the inner and outer wealth.